Joanna Esther Clark was born on October 22nd, 1989. The doctor waited until after my husband had returned from the nursery to tell us that Joanna had Down syndrome. We were surprised and not sure what that all entailed. My husband went home to tell the children. They did not put anyone else in the room with me, and so I was left all alone all night. I knew nothing about Down syndrome. All I could picture were the people from a group home I observed walking down the street, hunched over with their tongues hanging out. I was given no information to read or anyone to talk to. It was a long, lonely night, but during the night I decided whatever Joanna needed to do, we would all work with her. If she needed to learn sign language, all of the family would learn it. If she needed to do exercises, we would all help her with them. The next day, the doctor came in, and the first question I asked was, what does she look like, since I had only seen her for a few minutes after her birth. He said, you have a very pretty little girl there. He also told me that they had done the chromosome test and that it was not hereditary. It was probably because of my age, but age is not the only factor. Most of the children in Joanna's classes have parents in their 20s. One mom was 16 when she had her baby. As soon as I held her, all the worries were insignificant. If she had been our first child instead of our late-in-life baby, we would have had two choices for her: put her in an institution or take her home and let her be happy. Since the federal law was enacted in the 70s, which gave all children the right to an education no matter what their disability, there are so many opportunities for her. She has been able to have early intervention from the time she was 3 weeks old. The first year of Joanna's life was very difficult emotionally. When I once realized that we were in mourning, the healing process was able to begin. We were not mourning Joanna, but we were mourning the loss of a normal child. There are stages of mourning that each must pass through, such as denial, anger, depression, etc. Once we worked through our mourning, we began to accept Joanna as the wonderful person she is. We want for her the same things we want for the rest of the children, and that is for her to reach her highest potential and to be as self-sufficient as she is able to be. Some of the characteristics of Down syndrome is that they have almond-shaped eyes. Sometimes their arms and legs are shorter. Some have digestive problems or eating disorders. About 40% have some form of heart problems. Joanna had open heart surgery when she was 14 months old. They also have low muscle tone. The therapist explained that one must have muscle tone in order to have strength. Joanna was very floppy when she was first born because of low muscle tone. A major part of therapy in the first part of her life addressed the low muscle tone. With a normal child, they usually lead you from one stage of development to another. A child with Down syndrome needs to be helped from one stage to another. We first started helping Joanna strengthen her neck muscles with an exercise in which we put her over a roll with her head on one side and her body on the other. And then we would get in front of her and make noises, talk to her, or anything we could to make her lift her head. When she was strong enough, we progressed to other parts of her body. The therapist told us that a child develops from the head down. We worked on teaching her to roll over, hold up her head, and sit up. When we taught her to sit up, then we had to teach her to get down into a crawling position. We found out that the way we feed her could help her with her speech later in life. It has been fascinating what we have learned from Joanna about the learning process. The learning process is strongly connected to the physical aspect of the body. For example, when an infant pulls into the fetal position, they are learning about the center of their body, and centering is a part of reading readiness. Crawling is also a form of reading readiness. It teaches children opposites, since they use the opposite hand and leg to crawl. There are many opposites in reading, such as B, D, Q, P, etc. The process of feeding an infant is also pre-speech, as the child learns to use their mouth and facial muscles. The physical and intellectual is very closely connected in the learning process. Joanna was seen by an occupational therapist from the time she was 3 weeks old, who came to our home where she worked specifically with Joanna on exercises and fine motor skills. She worked with her on learning to crawl and to walk. Joanna walked when she was 2.5 years old. She has continued to learn and grow. She is about 1 year behind the other children her age and development, but she is progressing and learning, and that is what we want for her. Joanna has brought a special depth and joy into the lives of our family. She has opened up new avenues that we would not have experienced if it was not for her. We have learned simple sign language. We are not afraid of people with disabilities. Some of the children have looked into professions such as occupational therapy, special ed, and nursing. It has been my experience that if we run away from the trials given us, that we run away from some of our greatest blessings. It has not been easy or something I would have chosen to have a child with special needs. It has been a great trial with lots of emotional upheaval. But as we have accepted Joanna and have been bathed in her love, we have experienced greater joy than we could have ever imagined.